When using dental floss, take about 18 inches of floss. Don't worry about the exact length. Make the floss a little shorter or longer depending on what's comfortable for you. A common mistake that people make is wrapping the floss around their index fingers instead of their center fingers. This forces them to hold the floss with 4 fingers in order to guide it effectively. It's more difficult to get 4 fingers in your mouth than 2 fingers. So if you wrap the floss around your center fingers, you can now fold all your other fingers back, except the 2 fingers that you need to guide the floss. Now you can clean bacteria traps in tight spaces that you couldn't reach before with 4 fingers. You can shorten it up or unwrap it from your center finger if you need to make the floss a little bit longer. Guide the floss between the teeth to remove visible and invisible debris and bacteria. Position the floss all the way below the gum line. Notice how I have it wrapped around the tooth in a C shape. Observe that the floss is very short and my finger and my thumb are right next to the tooth and not way out here. It's very important that you hold the floss close to the tooth as you wrap it in a C shape, going below the gum line wherever possible. Then scrape up and down 1 or 2 times. Then bring the floss down and around the little point of gum tissue. Go below the gum line. Wrap it around once more and scrape down. Work the floss with the same scraping motion between the teeth, maneuvering it under the gum line in a tight C shape, then going on to the next area. Every area is going to be a little different. The floss will go deeper below the gum line in some places than in others. When flossing your molars, always get behind your last molar. By wrapping the floss around your middle fingers, not your index fingers, you will only need 2 index fingers back there. You're going to scrape upward behind the last molar. When you move forward to the next area, pop the floss between the teeth. Wrap it back around the back molar, scrape upward, and then curve the floss forward around the front molar. Scrape upward, and then pop it out. This is how you reach your back teeth with just 2 fingers on the floss. Use your index fingers, not 4 or 6 fingers in your mouth at one time. It's very common for left-handed people to scrub back and forth on their right side, and right-handers to scrub back and forth on their left side. Never start brushing at the gum line or scrub back and forth. The first place to put your brush is on your biting surfaces, where you can scrub as hard as you want without damaging the tooth surface. Avoid starting near the gum line, because the abrasiveness of ordinary toothpaste will wear ditches in your teeth. The enamel at the gum line, right at this area, is much thinner than the enamel on the biting surface. That's why this tooth is so much whiter on the biting surface than it is at the gum line, due to the thickness of the enamel. As you wear away the tooth surface right here, your tooth will start to turn yellow. So never start brushing at the gum line and never brush back and forth at the gum line. If you need to do some extra work on the gum tissue, gently vibrate the bristles, but always pick the brush up as you move it to the next section. You could also brush straight up and down like this, or you could brush in big circles. Just don't scrub, which is a natural tendency for most people, since they've been scrubbing since they were children. Your dentist or hygienist may recommend that you use a special tool to remove plaque if it accumulates in areas that brushing and flossing may miss. The first 2 tools are called rubber-tipped instruments because they have cone-shaped rubber tips. The third is called a sulcus brush. All 3 are used in the same manner. Plaque is an ideal medium for breeding corrosive bacteria that can cause bad breath, dissolve the jawbone, or destroy gum tissue. These tools are used where the tooth meets the gum to remove plaque and speed up healing by increasing blood flow to the gum tissue. The sulcus brush and rubber-tipped instruments are used the same way. Use the rotating and sweeping technique throughout your mouth. Clean the cheek side of your tooth, then the tongue side. Beginning between the teeth, stimulate the tissue by rotating the tool in a circular motion. Move to the next tooth, following underneath the area where the gum meets the tooth. Repeat the rotating motion in this new area and then continue around the entire mouth. Rotate at the gum line in between teeth. Sweep underneath the tissue and then rotate again, just like this.